Well, welcome to the Daily Brief on Metro Milwaukee's health and the economy, brought to you by the Medical College of Wisconsin and the Metropolitan Milwaukee Association of Commerce. I'm Tim Sheehy, and along with my co-host, Dr. John Raymond, president of the Medical College, each day we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. This webcast is powered by Aurora WDC, and today is our special guest, Omar Sheikh, the proprietor of Carnivore, the developer of the 3rd Street Market, and chair of Visit Milwaukee. And Omar will join us in just a minute, but first, let's start with an update from Dr. Raymond on our healthcare trends.
Thanks, Tim, and good afternoon, everyone. This first slide shows the incidence of new cases of COVID-19 in Wisconsin since March 12th. As you can see, we have flattened the curve. And the recent increase in cases on the right side of the slide is due to a combination of increased testing, which is very good, and the emerging hotspot in Brown County, which we'll be watching. Next slide, please. The second slide shows the daily incidence of COVID-19 related deaths in Wisconsin for the last 5 weeks. Now, many people focus on this metric as a key indicator for how various states are progressing through the pandemic. Although I do want to emphasize this is not a gating criteria for the Badger Bounce Back Plan. And like the information on the previous slide, this slide shows a flattening of the death rate and a possible downward trend, although there clearly is a significant day-to-day variation. Next slide, please. This slide is pulled from the new MMAC dashboard, which will be updated each day. The slide shows the daily percentages of new COVID-19 cases on the left and the daily number of new positive cases on the right. Wisconsin information is shown by the blue lines and Milwaukee data by the orange lines. These data are gating criteria for the Badger Bounce Back Plan, and it is important to track both of them simultaneously because our testing capacity continues to increase. Next slide, please. Because we flattened the curve in Wisconsin and in southeastern Wisconsin, we've not overwhelmed our intensive care units with coronavirus patients. The top 2 panels show trend lines for hospitalizations on the left and ICU bed use on the right. And the trends are going in the correct direction with a slow decrease in coronavirus-related hospital and ICU admissions. Now, the bottom panels show more detail about ICU bed use and capacity over the last 5 days. Data for the state are shown on the left and for southeastern Wisconsin on the right. The important takeaway here from the bottom panels is that we continue to have ample ICU capacity as shown in the orange bars. Next slide, please. This slide is similar to the bottom panels of the previous slide. The orange bars show that we continue to have ample ventilator capacity, both for the state on the left and for southeastern Wisconsin on the right. And these data are part of the new MMAC dashboard that'll be updated each day. If I could have the next slide, please. This slide shows the number of hospitals with 7 days or less of personal protective equipment. And the new enhanced data set includes N95 masks, gowns, surgical masks, face shields, and goggles for Wisconsin on the left and for southeastern Wisconsin on the right. Although there are serious supply chain issues for PPE, you can see some recent improvements shown by the continuing downward trend of the number of hospitals in our region and in Wisconsin that have critical shortages of PPE. Next slide, please. Now, during this difficult time when our comfort levels are stretched, innovation and ingenuity often prevail. And each Wednesday going forward, I'll be sharing with you 1 or 2 innovative ideas or important advances to watch. And I wanted to update you on recent buzz that suggests that several companies are pressing ahead with plans to have vaccines for COVID-19 as early as this fall. For example, Pfizer recently announced a collaboration to use modified RNA to induce COVID-19 immunity through a novel new approach. This vaccine candidate has already been tested in 12 humans, and this approach is similar to one that was announced last month by Moderna. The University of Oxford has developed a genetically modified COVID-19 virus that can't infect humans, but has been tested as a vaccine in 6 monkeys, with results that are sufficiently promising that the Serum Institute of India, the world's largest supplier of vaccines, has pledged to produce between 40 and 60 million doses of the vaccine with a target retail price of $13 per dose. And the Chinese biotech giant Sinovac has tested a chemically inactivated COVID-19 virus as a vaccine in 8 monkeys, with human trials to begin shortly. And what's noteworthy about the Sinovac method is it's a very old method of using an inactivated virus to be the vaccine. So hopefully one of these approaches will work and can be fast-tracked. Next slide. And finally, this slide shows 2 ingenious gadgets called the hygiene hook and the hygiene hand, which allows one to hook the door handles or to press elevator buttons without touching them. And with that little bit of innovation, I thank you, and I'll turn it back over to Tim.
So once again, mother is the necessity of invention here. So it's interesting, Dr. Raymond, as we move towards vaccines, presumably that little example you gave is part of what people may adopt in the next normal as they deal with this on an ongoing basis until there is a vaccine.
Yeah, exactly right, Tim. And we want to encourage innovation.
Yeah, great point. Omar, let's bring you into the conversation here. And thank you very much for taking time to join us. And you've got a number of hats here. The fine restaurant you're running, Carnivore, the new development you've got in the 3rd Street Market, and then of course your role as chair of Visit Milwaukee. So let me kind of do those in reverse. Let me ask you first about what you're seeing kind of as from your vantage point running Visit Milwaukee, and what you're seeing in the hospitality industry and how challenging that's been.
Well, I can't say I'm running Visit Milwaukee. I'm chairman of the board. Peggy's running Visit Milwaukee.
Right.
And so we communicate on a weekly basis. It's brutal. I mean, you're seeing a lot of cancellations because of the COVID threat. And so, if you take a look at how everything is funded, right, it depends upon, in large part of how the hotels fill up, right? And from the hotel tax to restaurants to overall tourism in general. So it's been a very rough go, and Visit has had to lay off a good number of people, as well as the Wisconsin Center District, Marty has as well.
Yeah, very challenging. Talk a little bit about the development of the 3rd Street Market. And while that's underway, you've also done some pretty exciting things for our healthcare workers.
Yeah, so 3rd Street Market Hall, we did put a 30-day hold on construction about 2 weeks ago. We still have a lot of work, even though the construction stopped for 30 days. We needed to close out on a lot of the leases for a lot of the vendors. A few of them are in a holding pattern, as everyone's fighting for their life. But we still have a really solid amount of great vendors and local chefs coming in. And Josh, Tony, and I are meeting, talking on a daily basis in the planning of it. So that's going really well. I'm really excited to announce that we did, through 3rd Street, work with Ryan Braun and Christian Yelich, and several sponsors. I mean, Associated Bank, Line & Kugels, American Family all helped fund an initiative that we did. We went to 4 different hospital systems, starting with Frederick and Aurora, Ascension, and now finishing at Children's this Saturday, where we're dropped off, 1,000 meals for workers and families, the frontline COVID-19 workers. So pretty proud that we all could come together and get the MVPs to put in their own money along with sponsors. Such a great initiative. Working on another one coming up pretty soon too that will be involved in helping the inner city.
Very, very much appreciated in terms of your giving back to the community and organizing that. Talk a little bit about your challenge as a business owner, kind of pivoting a well-established model in this time frame to do something much differently than you've been doing in the past.
Yeah, I mean, it started with a lot of research and kind of a wait and see what happens, right? And we've had to go down to a curbside service. In a tough time where everybody's losing money across the board, right? I don't think Carnivore's on the top of the list to get curbside. A family of 4 for $300, $400, $500, right? But we shut it down, and it's been very humbling. A lot of people reached out, a lot of people were texting, a lot of people were emailing, saying we want to support. And so we decided to open it 2 days a week, and it's been quite successful 2 days a week. Does that cover the nut? No, not even close, right? I mean, doing two days a week curbside, we're doing about 15% of what we would do revenue-wise from open 7 days a week. So it's been challenging, and and a little worried about, the next phases that come in when we're able to open, if we're held to being able to open, 25, 50% of the restaurant. I can assure you, I don't think the landlords are going to charge us half off, or the state company is going to charge us half off. So we'll see. We'll just have to really take it as it comes and do the best we can and be smart operators. I will say, we get Tim Sheehy coming more often at curbside service than actually in the dining room. So that's been great.
Yeah, you're going to put me in the red. But the other question I have for you, as you kind of look out ahead, what are your plans and what do you hear from your peers in terms of preparing for the recovery and getting to a point where your consumers are going to be confident that they're coming into a safe environment?
Well, we already started to do that the last week. We have somebody that was dedicated to spray off the door handles anytime anyone came in through the doors. Every time a guest got up, we would, wipe down the chairs, and in between all of the guests at the bars, we would wipe down the bar, wipe down the tables. All the chefs would be preparing things with gloves on, and even now with curbside, now we're checking everybody's temperature upon coming in. We're wiping down everything thoroughly. We're delivering in masks. We're delivering in, gloves. But when we do reopen, I envision us having one person dedicated to walk around and offer, Purell to our customers and things of that nature. So we're taking it very, very seriously.
Yeah. So it's going to be a challenge for the near future to operate. And I think probably even less so in terms of the safe at home impact for you and more just how your consumers react to the environment.
Yeah, there's no question, and I think that this is something very serious, and we're taking it seriously. And time will tell how things open up. And I do really believe that the curve, and it's great hearing from the doctor before this, that the curve it's flattened. And so I feel cautiously optimistic about the future. But in the interim, we're going to be very cautious and very careful with how we handle things. And I think that we'll build consumer trust by the way that we're operating our business. We're not to brag, but we've multiple winner of the Blue Ribbon Award. So the health department goes out and awards restaurants for, being the cleanest around town. And we've won it several times. And so we've always taken that incredibly seriously. And now with guidelines that we're given, we're going to go out above and beyond and just be great operators.
Yeah, thank you. So Dr. Raymond, I'll bring you back in. Chris will go to questions from our viewers.
Sure. The first question we had was for Omar. Omar, obviously noting that you're not a medical expert, but do you see when the light at the end of this tunnel might be as we see some of these other states reopen for in-person dining, even if it's severely restricted?
I think that's a better question for Dr. Raymond. I mean, I always try to stay optimistic. I guess we're going to have to see what the governor does with this May 26th date. I'm hopeful. It was great to hear Dr. Raymond speak because I really been talking to a lot of medical professionals and saying that the curve is being flattened. And so it's going to be, slow progress as we move forward, but I remain optimistic.
Dr. Raymond, it probably wouldn't surprise you that we have a question about remdesivir and some potential success it may be having in a trial.
Right. Well, there's been some up and down movement in the stock market with remdesivir. People are waiting for the results of some of the ongoing trials, and the initial release was not positive, although there have been some hints today that some of the larger trials showed some reasonably positive impact. So I know that the 5-day and the 10-day dose showed equivalent safety measures and equivalent results for the patients. So it's good news that if this works, that we can use a 5-day regimen instead of a 10. We really need that randomized controlled trial, which should be coming out by the end of the week, based on some of what we're hearing from the NIH. So I think it's possibly good news, but this is not going to be a magic solution. And we still don't know whether this would be applicable to people that are mildly ill or to the most seriously ill patients. We'll know more later this week, hopefully.
Also for Dr. Raymond, we had a question about the idea that you called the new infections a downward trend. And I think there may be a little bit of confusion when you see that huge spike right when testing increased. So you sort of have to, and maybe you're better to explain this, you have to kind of balance the idea that we're doing more testing versus more actual infections.
Yeah, you do, and that's very tough to do. So the good news is we've really almost doubled the number of tests that we've given over the last week on a daily basis. We need to do more of that. So in a circumstance where you're testing many, many more people, you would expect to have more positive tests. The real trick is to overlay that on how we were doing before. And when we had a relatively stable amount of tests, we had a stable to declining number of positive tests. So I'm still optimistic about how we're doing here in Milwaukee in particular, but I think the fact that we have this huge spike in Brown County tells you that we have a very connected state and we have to be vigilant no matter what happens going forward.
Omar, we had an interesting question from an audience member about the idea of increased outdoor dining and whether you could close down some city streets and spread some tables out a little farther to sort of increase the social distancing and still have that in-person dining experience.
Yeah, I mean, I think if you take a look at the restaurants, we're open to anything. We're really scared to open up with only half the capacity, like I was saying before. I mean, we're not going to get half steaks for half price. Nobody's going to get food or alcohol for half price. Landlords aren't going to go half off. So we're open to anything that would help us increase our revenue.
Dr. Raymond, we also had a question about the lead time currently required to get more PPE. Is that supply chain evening out at all, or is it still a huge challenge?
Well, what I would say is our Wisconsin companies have really responded well, and I think the supply chain is getting better, but I think we're going to have a problem for a long time with it. And this may turn into a situation where the just-in-time reliance on the foreign manufacturing might switch more to a domestic supply chain, and that's something that we need to monitor.
Dr. Raymond, we also had a question about the outbreaks in meatpacking plants that we've seen both here in Wisconsin and nationwide. Is there any concern about the actual food product that comes out of there spreading COVID-19, or is it more the workers and their families?
Well, obviously, our primary concerns are the workers who work in close quarters, and it's difficult for them to practice social distancing. And I've been wondering myself, could the COVID-19 live on pork, for example? Probably not, but I think that's something that needs to be looked into. And, many of the products that we buy are cooked, so that should take care of the virus anyway.
Then Omar, to conclude here, we've had a couple of questions about whether you've been able to take advantage of any of the federal programs out there in terms of funding.
I know a lot of restaurants have. We did not. But I do know a lot of restaurants have taken advantage of it. We did not.
Great. Thank you to everybody who asked a question today.
Good, Omar. Again, thank you for taking time out. Best wishes for a swift recovery. Dr. Raymond, thanks very much for the update, and have a safe weekend or a safe rest of the day. We'll be back with you tomorrow.
Thank you so much.
Thanks, Tim. Thanks, Omar.
Thank you, Doctor.